The Mess, a podcast in which we explore the mind-bending world of global supply chain, covering topics such as automation, innovation, unique identity, and more. I'm your co-host, Reed.
And I'm Liz.
And welcome to the show.
Reed and I were so lucky to talk to Brian Campbell of American Expediting. He was so amazing to talk to about how American Expediting went through a journey of moving their work to life sciences and how business transformation can be so very daunting, but also so very rewarding. As they shifted to life sciences, all of the various parts and pieces and information that's needed for transplants and life-saving surgeries are really brought to life. He talked to us how that transition went, how the life sciences businesses work, how standards play a role, and how utilizing technology to enhance healthcare is really a big topic. And he did talk about the future of the healthcare industry as well. I hope you enjoy this episode. Reed and I just had a blast just talking to Brian.
Hey, Brian, welcome to the show.
Hi, thanks, Reed.
We're happy you can carve out some time to speak with us today. But before we jump into the big topic, can you just tell us a little bit about your company and the position you play in and how you came to be where you are today?
I'm Brian Campbell. I'm the Chief Commercial Officer for American Expediting. We're a 40-year-old transportation company that really cut our teeth in first and final mile development. Worked really hard to, under our founder, Vic Finnegan, build a network across the country, including Canada, over the past 40 years. And then over the last 3.5 years that I've been with the organization, we went through a significant transformation into really a retail first and final mile provider to primarily a life science, life-saving transportation company. And it's an amazing journey since the pandemic and COVID transpired, how we were able to really learn and develop and grow and build our commercial strategy through that.
It's very interesting to me. We've all heard things in the past of like companies that we know really well, like Nokia comes to mind for me, 90s and early 2000s, the largest cell phone maker, but they were like a wood company in the very beginning. They made furniture or something. It was something drastic like that. But are you still doing anything in retail or have you transitioned completely?
3.5 years ago, 17% of our business was life science, Reed. And so primarily it was retail. And we still handle 20 to 30% of our business through retail. We love that business, but we found a lot of satisfaction in employees in actually saving lives every single day. That's really helped us spur that growth culturally, internally, and then also our message and how well it resonates with our customers. But we have customers from 40 years ago, were some of our first customers, still with us today in the retail sector.
When you say life science, life-saving science, what does that mean?
I give you a couple examples of what we do every single day. Out of the 2,000 plus lives that we impact and save a day, we could be saving a child's life that goes into renal failure. There's one drug company that manufactures this drug. It's housed in Memphis, Tennessee, that we have 8 hours to get that drug to a hospital to be administered into that child's life. You can imagine from the moment that doctor writes that script for that order, everything has to work perfect. The clock is ticking. We've had at times to where we have to hand carry and get on a plane with that small package and deliver to save that life. This month alone, we've had over 60 moves for kidneys and organs, our organ, blood, and tissue. Life-saving. It's being extracted in Denver and implanted in New York, or name the city. The coordination of moves and technology and the people, processes, and technologies that go through to be successful to save lives is another aspect. To clinical trials, whether it's modern medication or cell and gene therapies, we play a huge role in the transportation side of cell and gene. There's over 10,000 clinical trials over the next 5 years for cell and gene therapies where they may be extracting some DNA, some bone marrow in California where the patient is, but it's got to get to a lab in Nashville, Tennessee, so they can create a medicine specifically designed by the DNA of that patient and sent back to save their life, whether they have cancer or you name it. So we do a lot of that. We participated in over 70% of the clinical trials for COVID in those direct to patient, direct from patient deliveries and samples. Every day is something new and exciting, but you name it, we handle it all the way through North America, Canada, and the US. So.
That's amazing. And thank you, because it sounds like between saving lives and then being proactive to saving lives with the trials, that's amazing work.
It's the hardest work you can do. The thank you from you. It's really the team. Our employees When you think about organ, tissue, and blood, we prefer to have people that it resonates really well with. They may have been an organ transplant recipient. They may have a mother or a father that had it. Our cell and gene team through our critical care center, they may have a parent or a loved one that is battling cancer and they want to help make a difference. So we try to match that want and need from an employee perspective to actually what we do. When you match the excitement to what a patient's needs are through our customer service, these employees will do anything. So sharing that thank you to them is where it all goes. Because as you can imagine, vehicles break down, planes are late, weather happens and delays and diversions, temperature incursions can happen on deliveries and you go to plan B. It's really hard work. So it's about the people, and I'll be sure to share that thank you from you to them.
Please do. That's goosebump inducing, just the impact that that kind of work can have on day to day.
I didn't realize this was going to be this heavy today. Like the 8
Yeah,
hours,
right?
the temperature, the delays. Like I have 3 flights this week. So I'm like, it's delayed. I used to get crazy about it, but I've learned to calm down in my older age and it's part of it. But like, I can't imagine when it's life-saving things. And then you mentioned children and I'm like, oh my gosh, like.
It's extremely intense. And, our critical care center is 24/7, 365. And as you can imagine, everybody wants to know how that shipment turned out. You may be on plan C. You might have missed the first 2 flights because of cutoff times or not enough space on the flight. Plan C is you're grabbing an employee, you're giving them that box, and they're getting on the plane and guarding it with their life and flying there overnight to deliver it. And the whole company's on alert and really excited about how did we do. And when you get a whole community of employees behind you, and then seeing some of the patients, a couple months later in a thank you card, or you see their story on YouTube or another avenue where they're sharing their story and how cell and gene saved their life, and you know that you help make an impact and you get paid to do it, it's amazing. It's an amazing career.
So cool. And it's only been 3.5 years really since it sounds like you made that bigger jump into that type of business. How did that work? I mean, you were in retail and that's important too, saving lives. It's a whole different ballgame from getting a thing somewhere than a thing that means something, right? Or can save a life in a different way. How has that experience been? And as companies are pivoting to different models of work, do you have any best practices that you all have learned during that transition that you could share with them?
I think what we wanted to do was have more of a 3 to 5 year plan on transition and commercial strategy. COVID happened and we immediately went into how can we do this different? We had a pandemic disrupt the marketplace, not a product or technology or a different way of doing things. So being called from a very large CRO and then also direct from pharmaceutical companies saying, we need to push thousands of vaccination therapies out. We need you to take them, deliver them, collect them, bring them back, document as you can imagine. The regulatory requirements on handling therapies, medicines is quite complex, especially over state lines. Having to be able to be thrown into a situation like that, that's so important to the world at that time as we were out ahead leading it, really thrust us into 3 key areas that I would say any company that is looking to get into life science and be a significant contributor to that industry would be around people, processes, and technology. Earlier, we talked about that life-saving work needs to resonate with your employees. When you match that, you always have success. Employees will go home and make calls from home to check in on how it's going, how they can help. They're attached to it. They're imprinted through that experience and the processes. We're probably on our 10 millionth iteration of process for how we handle moves. We have 96 clinical trials that we're working on right now between cell and gene and modern medicine, direct to patient, direct from patient, that each of those may have 20 to 30 different SOPs and steps and processes. Each of those drugs may have a different piece of it that has a different regulatory effect in how you handle it. They all certainly have different temperature sensors. Some need to be transferred between 2 and 8 Celsius. Some may be negative Celsius, all the way down to drivers having to understand the process, be trained, and have a passion for this. It's not picking up an empty box and moving it. Could be an organ, a very important tissue sample. It could be bone marrow. So the training that goes into being compliant in the process is huge. And then the technology is changing every single day. Just yesterday, I got introduced to a brand new technology from a startup company that is revolutionary. And when you think about transportation, think about it in this aspect. You can get on your phone right now and you can order a sandwich and you can see it being made. You know when it's done. You know when Rod L picks it up to deliver it to you. You can track it all the way to your home and you get a picture when it's at your doorstep. So you don't have contact delivery. Off it goes. You get your sandwich. In transportation, that would be a dream come true. It's so complex. You have to be able to see that technology from pickup all the way through delivery. And then behind the delivery comes all of the regulations and POBs and PODs, and then all the data that has to go back to the Pfizers, the AstraZenecas, the Merck, all that data that goes back, because every second is managed. Every second, the clock is ticking. The second that cell and gene therapy gets released, the bone marrow is released, the kidney's on the move to the next hospital. It's like a pilot that flies in the air. If something happens in the air, they spend the next hour after the flight's over writing the incident and documenting it. We have the same processes. So when you're moving thousands of shipments a day and coordinating that, and you may have a successful shipment, you have to still document things that occurred during that movement according to regulations. So technology is a huge piece. Those are the three areas. If you can match the people and then you can match the processes and know that your process today is going to be different tomorrow because something's going to happen you've never experienced before. And then if you have technology that wraps it all together and makes it easy to do business with, provides the visibility and temperature readouts without us having to report it or them having to log in to get it, they can look at an app. They can pretty much self-serve from the beginning of the process to the end. You'll be wildly successful in this industry. And we're trying to innovate, and we have some really exciting products that are going to come out over the next year from a technology aspect. But start with people.
You just struck a chord with me. We did a podcast a little while ago talking about healthcare product recalls. And you're talking about technology and industry. And it was amazing to me because they gave the example of like an automobile recall. Let's just say Liz drives a Honda and I drive a Toyota and you drive a Ford. If Honda has a recall, it only goes to the one that has a Honda. It doesn't go to those that are driving Toyotas or Fords. But the healthcare and hospital environment, if there's a recall, it goes to everybody. So like this process and efficiencies and inefficiencies, it's amazing to me. But we're seeing a lot of change in the healthcare industry, especially over the last 3 years. Have there been any major changes that are causing issues for the life sciences sector or enhancements for the life sciences sector? I'm interested in your opinion on that.
It's a different world in life science since the pandemic. Each state has a lot of different regulations that they're changing. I'll give you one really interesting change that's happening right now from a hospital perspective, and one that I'm really excited about that we're participating in at the entry level is what hospitals learned during COVID was that beds weren't available. Hospitals were overwhelmed and normal surgeries couldn't take place because of all of the treatments for COVID happening in hospitals. So now hospitals are getting really smart. And instead of patients within the counties around them coming in and seeking medical surgeries that may last a week, 2 weeks, a month, they're coming in, having the surgery, and then they're going back home. Major surgeries going home, and doctors are visiting them once a week. Nurses are out there daily. So it's home healthcare in order to minimize the amount of traffic into hospitals and congestion. Patient care through studies dramatically has improved when it's taken care of at home. And that's what we learned during COVID is we saw nurse practitioners and nurses going out into the field, doing home healthcare infusions. But now significant medical procedures, being able to be released from the hospital, ambulance back home. But all of the things that you would have in the hospital are now in the home, and doctors will come to you and check on you. It's an amazing program. It's working well. It should significantly improve patient care, being able to be at home, not have to travel to certain places. It's doing it completely backwards than what we're used to, but it's the future. And being part of that as an organization is really interesting to watch. What they're finding is you actually heal faster, have a more positive attitude when you're around loved ones 24 hours in a familiar home, familiar bed. Patient health recovery is significantly enhanced when being performed at home, which is pretty interesting.
It's fascinating. I can see that. I would also see that some patients may be a little bit nervous about going home because there's that sense of stability in the hospital. I've had my appendix out a couple of years ago and I was petrified to go home because what if something happened? But if you have that support that could be there quickly and you're in your own house versus, right?
When I'm in a hospital or getting a physical or around a doctor, my blood pressure goes through the roof.
White coat syndrome. You got the
white
coat syndrome.
My wife's a nurse. She takes my blood pressure at home and it's perfect. So I think I would fall into the camp of treat me at home. I think I'll be great there.
So it sounds like the healthcare industry, just like all the other industries, are going to continue to change and evolve. And that example that you just gave is just probably one of many that are going to happen. So as these continue to shift and evolve, from your perspective, what role do standards play? I mean, Reed and I are experts at how standards, right, can help interoperability and things like that. From your perspective, how can standards help work through well when the industry is changing and evolving?
That's a tough question to really put a fence around and answer because it's the same as trying to create processes that are going to work for everything we move on the life science side. Being really compliant, having a strong compliance team that understands the training aspect of it, understands the regulatory and the rules behind it, the different products. You can't just deliver medicine and not really know the impact of it or the study. You have to really, as an organization, understand these 96 studies we have currently going on. You have to know them inside and out. It's those processes that I think raise our bar of standards in our organization. No transportation company in life science is going to be 100%. Something's going to happen, and it's unfortunate when it does happen. But you learn from those experiences to just raise the bar even higher. An hour before this, I'm working on an emergency in Denver. An event happened on a cell and gene recovery that I want to see around corners, but we couldn't predict what happened in this event. It's a first-time event, but now we're putting in a new standard, a new procedure and process to how to handle it. And I think we're going to go through that every day. I don't want to steal Bezos' saying, but it's day one in our organization every single day. It really is. How do we redevelop those processes and those standards to where at the end of the day, our customers are extremely satisfied. Our patients are healthy and receive the promise that we delivered. We saved their life, or we impacted their life in a positive way. That resonates in the field. So we continue to gain the trust of additional customers and in hospitals and in clinical trials. But we do a lot of marketing behind the scenes to understand the impact that we made, where we can get better, what we can constantly strive for, and raise the bar so high. Seems like it's unlikely, but it's amazing how far you go, the higher you raise that bar. So the standards will always be evolving, and that's through our processes. I hope that answers that question well.
Yeah, it's interesting because earlier in this year, the United States, through private sector, launched the largest rocket known to man, and it blew up. And they considered it a major success. And I was confused. And then you hear Elon Musk talk about it, and it's like, we need to learn. There's a lot we need to learn. This is what we were going for. We were successful to this and anything above and beyond. And so thinking about what you all are doing, it's the attention to detail and expanding on those attentions to detail and these counters, right? Of, option 1, option 2, option 3. We have to plan for the unplannable, but even then you don't know what it's going to be. So you do the best you can with that. I'd like to know what's next for American Expediting. What do you think is next for the healthcare industry in general?
We continue to expand through acquisitions, and we see ourselves as the premier first and final mile healthcare provider. And we want to continue to expand on our work with CROs or hospital networks or organ, tissue, and blood. We fully intend on continuing to expand and open up new markets. Our network is very large and one of the largest in our field, but we'd love to continue to look at other spaces as well, but also other add-ons that help us really help the end user, the patient. I give you an example, Reed. A nurse could be going to the same facility we're going to administer the medication we're delivering. Well, why can't we team up with that nurse and say, hey, can you pick this medication up? You deliver it. How can we offer that type of end-to-end service? So we'll be looking at those things and a lot on the technology side. We have a new CIO that came in with a lot of great ideas and a lot of experience. in that field. So really trying to provide an offering for our customers that is uniquely different than who our competition may be or anyone else in the field. So we're going to be heavily focused in those areas. From the healthcare industry, I think we've all heard a lot about Chat GPT over the last 3-4 months and how that's transforming a lot. Technology is transforming a lot in transportation. Earlier, I said you can get a sandwich from Jimmy John's and you can track it all to your home. And now I'm saying technology is transforming a lot in our space, but it's doing it in a different, unique way. From technology and medications to technology and how it's delivered. You think about in the organ world, there's over 100,000 right now on an organ transplant list in the US. There's 100,000 people waiting for an organ transplant. Every 9 minutes, 7 more people get added to the list. So during this podcast, 14 more people are added to the list. There's so much data out there on where these people are willing to donate to where the donations are needed, that technology behind the scenes can already match these people up for future when the need is there, by state, by geographic location. So implementing technology to be a little more predictable. Even the data earlier I was saying on the drug that saves a child's life when they go in renal failure, we know with certainty that for some reason, the state of Florida is where this happens a lot more often. What we've recently done is we've gotten our licensure in the state of Florida. So we can actually, instead of that drug being in Memphis, we use the technology AI to tell us, if you put it in Orlando and get the licensure to store it there, you're now going to save 1,000 lives in the state of Florida over the next 12 months because you're 3 hours to delivery north and south of Orlando to all the hospitals. So using technology to help us be more predictive, build out how we can be closer to the patients in need. And then also, even in our moves, technology can connect a kidney that's landing from Denver to LaGuardia. That technology can transmit all the way to Highway Patrol. So they're out ahead knowing the plane just landed. In 7 minutes, we'll be going through mile marker 123, police escort from there to the hospital. To also that technology, contacting the actual surgeon, who, when you imagine the surgeon gets the text from us that says, we're 7 minutes out. He goes into the patient's room, and I can imagine the family sitting there and saying, great news, the kidney's made it. I'm going to go get prepped for surgery, get ready. You can imagine the impact that technology is making and is going to have versus not being able to let that doctor know in advance or know where that's at in transportation, to where he has a different story to tell the mother or the family there that we don't know where it's at or when it'll be here, but keep waiting. It's amazing how technology will play and how disruptive it'll be in a positive way.
I have a random question for you. I wrote down the 100,000 people are on an organ transplant list at any given moment. Every 9 minutes, 7 more people are added. How many come off the list per day?
I can tell you the worst side to that. I can tell you that 20 people a day die in the US waiting for an organ. There's over 7,000 deaths annually in the US for people waiting for an organ. So when you think about coming off the list, they come off in 2 ways, right?
I didn't even think of that. I'm a think positive type of guy, but you just hit me with this reality right between my eyes. I did not think of that. I didn't want to bring us down. Does it kind of stay within like a 3 to 5% of that 100K, or is it exponentially growing?
Yeah, it's been growing every year. It keeps growing. I'm an organ donor myself. There needs to be more education in the field.
I am
parents talking to children. My wife and I are, and I'm sure our children will be. There's still the unknown. And I don't know if you guys have seen anything recently out there about understanding of what an organ donor could be or the impact it could make. I don't know the exact numbers on how many are coming off, but I know how many come off in the negative way, because I would love to speed that up and slow that down.
It sounds like you're very familiar with lots of technology, both for work and I'm assuming for your personal life. But what's the favorite thing that you're using in your life right now from a technology perspective?
In my personal life, I'm a nerd for understanding where my heart rate's at. I've got the ring that tells me all of my information. My watch is telling me everything, my scale. I'm a nerd for that. I love that type of technology. Anything that can help me in my life be more predictable. I would love to know if something's not right. Professionally, the technology that goes into the packaging, I'm so fascinated by this. I think we talked about it a little bit earlier. The technology that now in a chip, that when you think about having to have 2 to 8 degree temperature Celsius on a delivery. And the technology now is it can go into a 12-liter space box. It can be plugged into the wall to cool it down within a matter of a couple hours. And then it stays that temperature unplugged for 98 hours straight.
Wow.
Imagine the efficiency you can have versus right now, from a green perspective, you're using Credos or bio boxes that you're stuffing dry ice into, or you're putting gel packs. The future technology of how these medications can be delivered and reused, not cardboard boxes being thrown away. Or, I love dry ice for my camping and fishing trips. There's always going to be a need for it. But the amount of dry ice that's used in our space is ridiculous, and the impact that has on the environment, as well as these gel packs that just get thrown away. You'll be able to make a difference both environmentally, but then also efficiently, is monumental in our space. So those are the things that professionally and personally I'm pretty passionate about.
The other question we always ask everybody, and we always have it in all of our episodes, but especially in this one, this one's been heavy. But what's something that's blown your mind? It's just changed the way you look at the world. Like it's just an event that happened and it's forever changed you and it's blown your mind.
Watching COVID happen. I had, brand new into my commercial position for this organization and going, well, how is this going to impact? What's next? I don't think any of us really knew, like, what was going to happen tomorrow? You're sitting with your family watching TV saying, well, this is something we've never lived through before. And being on the back side of that now and seeing how, whether it's good or bad, the planet has changed dramatically. How we communicate is completely different. How we're almost closer together but further apart in so many ways. It's been amazing to watch this world transform, but it's also like it's the new discovery part of our population, and everything's possible now. Where I think we were kind of stuck in a like, well, it's cool. We got some new cell phones that you get updated, new cell phone every year. It's cool technology. Now it's everything's possible. There's nothing that can really stop you, because if we can get through that period of time where you weren't sure what was going to happen to now all the positives that have come out of it and the technology that's come out of it, I think we'll look back on that period of time and say that was a big turning point in where we're at today. So that's still something that I try to wrap my head around. And really, when you think about it, how did we get through that? I don't think anyone's taken the time to reflect and go through that and say, wow. And I'm sure what you do every day has changed. You're just your daily routine. I know our organization shifted completely, and some organizations shifted completely to an obsolete way because they couldn't do business the way now the world needs it to be done.
You brought up like, how do we get through that? And something that happened to me a long, long time ago, lots of different little spaces in time. It's like, I'll never be able to do that. And then you do it. Right. And I remember on my grandmother's deathbed, I was lucky enough to be speaking with her right before she passed. And we were having a conversation the day before she left this planet. And we got into some of her history. And she was 88 years old. She got married in 1932 in the height of the Depression. And she's like, we didn't have any money. We didn't have anything. And then they lost their first baby. And then they had 4 more. And I'm like, how do you get through that? Like, you've never even spoken about it. I didn't even really know. And it's just like the human species, as complicated as we are, we're really quite amazing in what we do. And, the innovation that's come out, and there's that phoenix, right? There's always something that's going to rise from the fire and good things that happen. Well, Brian, that's all the time we have for today. As we started this thing, we really appreciate you taking the time with us. You dropped some knowledge on us that I was frankly unaware of. It was a bit of a heavier conversation this time, Liz, but one that was definitely rewarding for me.
Yes, absolutely. Same.
Thank you again, Brian. We really appreciate your time today.
You bet. Thank you.
Thank you for joining the Next Level Supply Chain with GS1 US. If you enjoyed today's show, you can subscribe to our feed or explore more great episodes wherever you get your podcasts. Don't forget to share and follow us on social media. Thanks again, and we'll see you next time.